you do have time to volunteer, so do come up in our future meetings and try to present something for the rest of our group. Dr. Susar Viswanathan Garu, it's my third time in a row to introduce him. It's my pleasure to introduce Dr. Viswanathan Susar Garu. He's a board-certified physician in internal medicine and geriatric medicine, practicing in Elgin. Thank you very much, Andy, for coming over. He was past president of Provena St. Joseph Hospital medical staff of over 250 physicians. He was a past delegate representing Provena St. Joseph medical staff at AMA OMSs for several years and a past member of governing council of ISMS and OMSs. Furthermore, he served as chairman of medical departments at both Provena St. Joseph and Sherman hospitals in the past. He's joined by his daughter in primary care medical practice like 5 to 6 years ago. Welcome, sir. He will be talking about dementia.
Thank you, Bhargav Garu. As you said, only English they all switch back and forth. TAGC kada Telugu glamour a flavor. Dementia is such a common condition as we advance through this aging process. Especially the signs start beginning about 65 and then it keeps going. So if you look at the society, people who are living longer, more chances of them getting dementia. Before I start, I want to share with you a couple of small stories. A grandson in his 20s takes his grandmother to a doctor's office. And this is his second visit. And she says, so he gets very irritated and angry. He says, I don't need to write it down. I can remember everything. Ice cream, strawberries, and whipped cream. I got it. For goodness sake. So he toddles into the kitchen. After 20 minutes, the old man returns from the kitchen, hands his wife a plate of bacon and eggs. And she stares at the plate for a moment. Where is my toast? So I'm sure everybody got it. So this is a very devastating illness. And I'm going to go over a bunch of slides I try to organize. And I want all of you to join me to walk through these slides. If we look at the ancient Indian literature, Charaka Samhita, this recognized as Chittanasha.
Lights off in this?
Yeah.
Okay.
Okay, lights. Yeah, that's one you can leave it on. Yeah. And the Rasayana Tantra is the name for geriatrics in those ancient Indian times. So dementia was called Chittanasha or Buddhinasha. And Ashwagandha is a small evergreen herb, and turmeric, were used as remedies. On the top of that, there is a herb called as Brahmi, and another one called as Palapushpi. Shankapushpi, that is the name of that. And this is a concoction, the Brahmi and Shankapushpi, they mix, and then now it is being marketed in Ayurvedic stores as Memory Plus. So what it does is it slows the damage of the nerve cells in our brain if we take it on a regular basis, more or less like a tonic, and then tries to preserve our memory. So this is what was used. What does dementia mean? It's impairment of brain function, decline in intellectual functioning that interferes with our daily routine activities. And these disorders are caused by changes in our brain. People with dementia are confused, disoriented and confused to person, place, and time, and it is not a normal sign of aging. And there are many causes for dementia and types of dementia. And fortunately, we have some reversible causes. Them being vitamin B12 deficiency, which is present in large amounts in people who eat non-vegetarian, especially liver, and thyroid problems. If somebody has a low thyroid, their memory gets affected. So, and the metal poisoning like mercury and aluminum, and depression, which is a very common thing. And people who are very depressed for whatever reason, domestic loss of, domestic problems, loss of a spouse, children, whatever, loss of a job, that depression itself gives rise to the loss of memory. But these reversible things, they're easily treatable. We make a diagnosis, what all we got to do is start treating them, and then they'll bounce back and they will restore their memory back to normal. But the second one, irreversible, sometimes can be controlled by treatment, but we cannot cure it. The examples being multi-infarct dementia, Alzheimer's disease, which we are going to talk about. And there are other illnesses like brain injuries, AIDS, tumors, and infections. So multi-infarct dementia is a dementia we see in people having high blood pressure. And every time they have a mini stroke that results in destruction of the nerve tissue, and thereby their lapse of memory starts and then it continues. And for a period of time, it can really become a serious situation. About 20% of all dementias are of this type. Now, Alois Alzheimer, he's a German. He's a psychiatrist and a pathologist. Back in 1901, he followed a 50-year-old woman with bizarre symptoms. He did not understand what they are. So he followed her from 1901 to 1906, and then she passed away. Then he did a postmortem examination of her brain and found out some unique things. And he first reported in literature, and thus this disease goes by his name, Alzheimer's. And this is a progressive nervous disorder. Eventually destroys all mental and physical function. 3% of the population has Alzheimer's between 65 and 74, and 75 to 80 years old, about 19%, and above 85, you can see how the percentage jumped, 47%. So now the question is, I don't know the answer, but I think I'll leave it to each of you. Living longer, is it a blessing or a curse? And Alzheimer's disease, from the onset of the symptoms, it can last anywhere from 3 to 20 years. The average life expectancy is 11 years. It's a terminal disease, and you can see only 42%. 42%, they get $100 to $499 per month, which is a fraction. And the caregiving support, that means the person who attends these patients on an hourly basis, only 32% have 8 to 24 hours per month, not per day, per month. And 49 hours or more, only 19%. And we will see in the next few slides as the disease advances, they become so helpless. Care givers, they really need very bad. Okay, now, there are so many theories for the causation of Alzheimer's. And genetics, of course, it comes top in the list. And if we look at our chromosomes, chromosome 21 is the culprit. As we go along, it will become more clear. And a person who has a parent with Alzheimer's, there is a 36% of incidence in Alzheimer's. And if two parents having the disease, then of course it's 54% higher risk. Now this is a slide, a very important one. I don't expect all of you to understand medical jargon, but briefly, the one you see here, this is the nerve cell. This is the nucleus. And the nucleus has 23 pairs of chromosomes. This is how the chromosome looks like. Chromosome has genes embedded in that. And in Alzheimer's disease, the chromosome 21 is the culprit. And it is genetically transmitted. And in the early onset, even though it is very rare, it's mostly running in the family, so it is more genetically oriented. The late onset Alzheimer's disease is common, and they have identified a gene that produces a protein called apolipoprotein E. And they believe this protein is involved in the formation of these protein plaques, called beta amyloid plaques. So this we went through. And Down syndrome, I'm sure many of you heard that. It's the mutation in chromosome 21 results in Down syndrome. And these people, unfortunately, they don't make it. But if they live up to age 40, invariably, they go through Alzheimer's disease. And environment. We do not know clearly how environment plays a major role, but there is some evidence that it is quite possible it has got something to do producing Alzheimer's disease. For instance, Guam is a country, I think it's in Latin America, I'm not sure, I'm not too good in geography. Anyway, there is a very high incidence of Alzheimer's disease in Guam. And let us say mother's age. The mother conceives the child at an advanced age. There are greater chances of child getting into this Alzheimer's situation. Aluminum, viruses, people who have head injuries, especially these football players, there was 3 times higher incidence of Alzheimer's when compared to the other people who are not subjected to head injuries. Now, this is the cellular and molecular level. In our cell, we have the metabolic organ called as mitochondria. And that's where the metabolism takes place. And in the body, this is one of the theories of aging process. There are what we call free radicals. They are produced, and these free radicals, they damage our tissues, especially the mitochondria. And this is also the reason why we age. And this is by oxidative damage, they destroy. And the theory is these free radicals producing and damaging stimulating the nerve cells in the brain, neuronal cells, is responsible for Alzheimer's disease. Anyway, this is one here. And surprisingly enough, there is an amino acid called homocysteine, and it is found in large amounts in this field. And now I'm going to go into the normal anatomy, and I want all of you to appreciate how fascinating it is, how the brain works. And you can see, మనం చిన్నప్పుడు సైన్స్ కోర్సెస్లో పెద్ద మెదడు చిన్న మెదడు అని చదువుకున్నాం మనం. And పెద్ద మెదడు is called as the cerebrum. చిన్న మెదడు is the cerebellum. And this is hippocampus, this is thalamus, this is the hypothalamus, this is the brainstem. I'm going to come back to that. Each of it is extremely important for our function. And now, if you look at it, this is a very fascinating thing. Adult weight of the brain is about 3 pounds. And it looks like a medium-sized cauliflower. And you will be amazed, it keeps 100 billion neurons, that means nerve cells. And each nerve cell is connected to another nerve cell by a network like this fine electrical wire, and 100 trillion. 3 main players, the cerebral hemispheres, that is this portion, where sensory information is received from the outside world, is processed. This part of the brain controls voluntary movement and regulates conscious thought. The gestures only. And after a couple of minutes, he yelled at her, "You stupid woman, you have pulled the black whites." He wanted the red whites. So this is how the patients behave. And funnier than this, there is another story, and it was written on June 11th, 2011. It was so cute and funny, you had to imagine the cutest and sweetest old man with the story. Our patients have private rooms, and we do towel pads in the morning. They distribute the towels for each patient. So I give him his clean towel for the day. About 10 minutes later, I see him walking towards the dining area in nothing but white undies. And I'm sure all of you know, undies is underpant of a female, Victoria's Secret. And one little hand towel hanging over his shoulder. And he comes up to me and goes, "I'm supposed to meet some fellas at the pool, and I'm running late. Can you direct me to the pool?" So he always thought he was in a hotel. So he did activities against resistance, Nautilus, Cybex, in this fitness at home, see these machines. And they found out very surprising results. And there is modest improvement in executive function, memory, when they were subjected to physical activity. But aerobic and strength training combined, and it improved working memory, attention and processing speed. So the older folks, that means 80 plus, they have greater working memory. And people with minimal cognitive impairment, improvements were small in executive function, but memory-wise, they have larger improvements. In patients with early stage of Alzheimer's disease, exercise definitely helped them, and it prolonged the time period of the current stage. The health awareness for our TAGC members. Not only TAGC, our own community. Thank you.
Some more Sudoku puzzles for all of us from today onwards, right? That's what I actually advise my patients, do a lot of memory games and like puzzles every day to improve your memory. That's the only way to prevent Alzheimer's. Thank you very much, Viswanathan Garu. Very well presented with really cute real-life examples. I know I could have given a couple more, but I think we are running out of time. I would want all of you to take a 10-minute break, enjoy the snack and tea, and if you have any questions about dementia, you could simultaneously ask Dr. Viswanathan Garu. Okay, and one other request. By the time we are done with the second topic, please don't forget the first topic.
When we take prednisone, it causes depression. You gain weight, it loses the mood. Right? So prednisone or corticosteroids. These are the other medications that can cause depression. That comes under decline in health. Disabilities and limitation. So the most important disability that limits your activity is stroke. So when the chances of having stroke, if you don't take your blood pressure medicine properly, can cause stroke. So stroke is the stroke that is affecting the brain. So when they have strokes, it can be mini stroke and a major stroke. In the major stroke, what happens is they have either weakness in the left side or right side of the body. Sometimes they lose their speech, so they cannot communicate. That makes them frustration and they feel incapacitated. All of a sudden they were doing good, and then now they had a stroke, they cannot do anything. That keeps them feeling depressed automatically. So those depressions sometimes can be also treated. The depression secondary to the stroke, and they lose some memory, but you have to diagnose with all these thyroids tests as well as any other medical complications that you have been using. We talked about some what they usually like, crying, moody, wanting to be alone, thinking of suicide. So any 5 of them, if you experience, that can diagnose as stress. So see, that's what, see, here, if 5 of the signs for the last 2 weeks, they have to be constant, not just one day. So next train is normal, next day, no more stress. So stress test leads to ability to cope. So that's why the doctor orders stress. You go to a treadmill and they take the EKG. So how much your heart, they are doing the heart stress, not the emotional stress in that. So the heart stress means whatever the specified time, you break short, in 3 minutes only you get chest pain, and your heart is stressed. That's a concept. So any 5, anything 1, 2, 3, 4, 5, 6, 7, 8. Okay? So that can cause depression. You can see the picture, how they feel. They just look at the window, staring, or keep their hand on the head. Signs of depression: physical, eating too much.